Hi, I'm Diane Newman.
And I'm Dean Laganosky.
In this series of brief videos, we'll debunk common myths about overactive bladder or OAB and its treatment.
Here, we'll reinforce the need for treatment of OAB in men who may also have benign prostatic hyperplasia, or BPH, and we'll briefly explore the use of Gemtesa or Vibegaron in men with both conditions. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of OAB with symptoms of urge urinary incontinence, or UUI, urgency, and urinary frequency in adults, and for the treatment of OAB with symptoms of UUI, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, or BPH.
Gemtesa is contraindicated in patients with known hypersensitivity to Vibegaron or any components of Gemtesa. Hypersensitivity reactions such as angioedema have occurred. Please see full important safety information at the end of this video. Dean, I think some of our colleagues believe that treating a man's BPH symptoms will also resolve all of his bladder symptoms. Is that always the case?
Actually, no. The fact is, the causes and symptoms of OAB and BPH differ, so treating BPH may not resolve OAB symptoms.
I agree. BPH primarily consists of voiding-related symptoms, trouble starting a urine stream or hesitancy, weak or interrupted urine stream, dribbling at the end of urination, and urinary retention. OAB consists of storage-related symptoms including urgency, frequency, and incontinence. But BPH can also cause problems that are associated more with storage, including frequent urination, urgency, and the sensation of incomplete bladder emptying.
And that would explain why OAB symptoms are sometimes incorrectly attributed to BPH.
Right.
The truth is, men experience OAB nearly as often as women, but due to the misconception that all voiding symptoms in men are attributable to the prostate, OAB is often underdiagnosed and undertreated.
In fact, oftentimes I have patients referred to me who are receiving treatment for BPH, but are still experiencing unresolved symptoms of OAB. Additionally, other men may just have OAB.
Great point. So what is your overall management approach for men with symptoms of OAB, and how does that differ from BPH?
Well, first, I recommend lifestyle and dietary modifications for all OAB patients with or without BPH. However, when it comes to pharmacological treatment, approaches may differ between BPH and OAB. For patients with OAB symptoms, antimuscarinics or beta-3 agonists should be considered. In my practice, I tend to diagnose and prescribe OAB medications to patients who are already being treated for BPH. In these patients, I prefer Gemtesa, the first and only beta-3 agonist approved for the treatment of OAB in men being pharmacologically treated for BPH.
In summary, OAB differs in both its presentation and its treatment as compared to BPH, so we as clinicians should be diagnosing and managing it separately to help ensure maximum symptom resolution for the men in our practices. Now, please continue watching for additional important safety information for Gemtesa.
And be sure to watch the other videos in this series.
Indications and usage. Gemtesa is a beta-3 adrenergic agonist indicated for the treatment of overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adults. Overactive bladder, OAB, with symptoms of urge urinary incontinence, urgency, and urinary frequency in adult males on pharmacological therapy for benign prostatic hyperplasia, BPH. Important safety information. Contraindications. Gemtesa is contraindicated in patients with known hypersensitivity to Vibegaron or any components of Gemtesa. Hypersensitivity reactions, such as angioedema, have occurred. Warnings and precautions. Urinary retention. Urinary retention has been reported in patients taking Gemtesa. The risk of urinary retention may be increased in patients with bladder outlet obstruction and also in patients taking muscarinic antagonist medications for the treatment of OAB. Monitor patients for signs and symptoms of urinary retention, particularly in patients with bladder outlet obstruction or patients taking muscarinic antagonist medications for the treatment of OAB. Discontinue Gemtesa in patients who develop urinary retention. Angioedema. Angioedema of the face and/or larynx has been reported with Gemtesa. Angioedema has been reported to occur hours after the first dose or after multiple doses. angioedema associated with upper airway swelling may be life-threatening. If involvement of the tongue, hypopharynx, or larynx occurs, immediately discontinue Gemtesa and provide appropriate therapy and/or measures necessary to ensure a patent airway. Adverse reactions. Most common adverse reactions greater than or equal to 2% reported with Gemtesa were headache, urinary tract infection, nasopharyngitis, diarrhea, nausea, and upper respiratory tract infection. Please see accompanying full prescribing information.